Thank you, Chair, and thank you, Ranking Member Griffith, for convening this group today. Dr. Fauci, it's great to see you again. Years ago, I sat when Dr. Tom Provost, my chairman at Hopkins, brought you there to lecture us, and you've continued a career that has had impact throughout the decades. Dr. Fauci, I have two separate questions that I think will really have you reach into the skill set of immunology, which is one of your many areas of forefront. As we continue to see advancements in second-generation vaccines, do you believe that innovations such as intranasally administered vaccines, those that allow the development of IgA or mucosal immunity, do you think that those should be considered as we reach to the next step of vaccines?
The answer to that is yes. I mean, there's a lot of interest, and there always has been, about exposing mucosal surfaces against vaccines that are essentially transmitted through the respiratory route. So you're right. This will be the second and third generation vaccine, and there's research already going on that we are supporting at the NIH level. So I would imagine that you are going to be seeing, after we get this all under control, I don't think, as you probably know, it's not going to be ready to essentially get the pandemic under control. But we're going to have respiratory illnesses that are essentially emerging in pandemic form for years and years to come. And we may be having to deal with SARS-CoV-2 for more than just the next year or so. So you're quite correct, Congressman Joyce, that those type of innovative approaches towards vaccine are definitely on the table.
Dr. Fauci, as we look to possibly address the lack of adequately immunizing pediatric patients and the risk wards with certain current vaccines, should we be looking at less invasive methods of vaccine administration, specifically the intranasal route? And I'm going to use the analogy of Jonas Salk, who developed the original polio vaccine in my home state of Pennsylvania. But I didn't receive the Salk vaccine as a child. I received the Sabin, the oral vaccine, where we were lined up and taken to school and received it on a sugar cube. So when we address parents' hesitancy to immunize their children, is there a role for the intranasal route as it continues to be developed?
The answer is yes, the same answer to what you had mentioned to your first question. You recall that this is something that we faced with influenza when we developed the flu mist, which was originally designated for children, originally saying that you don't want to give children an injection because they may not like it. It turns out, from an immunological standpoint, it also had some value added there. So the answer to your question is yes, we will be pursuing alternative methods of administration of vaccines, both for SARS-CoV-2 as well as for other diseases.
Thank you, Dr. Fauci. Dr. Walensky, my next question, and we've addressed this in some levels in earlier questions, but we realize that there's a vulnerable population, approximately 500,000 individuals in the United States, who suffer from kidney failure and are going hemodialysis 3 times a week on a regular basis. And a lot of these patients, actually, I think the estimates are close to 90%, have multiple comorbidities like diabetes and hypertension, and they face a 20+% mortality rate if they contract COVID. Unfortunately, they remain largely unvaccinated. And considering these are high risk and we want attention to health equity, what are your steps for bringing these vaccinations to these patients who are going to hemodialysis centers 3 times a week, have a great support staff providing that hemodialysis? What next steps should be taken to allow the immunization of these patients who have kidney failure and allow their workers, those who participate, the technicians who provide that 3 times a week hemodialysis, what steps should be taken? Should that immunization occur right at their dialysis centers?
Thank you for that question, Dr. Joyce. Yes, we are actively working now. Of course, we had supply constraints early on, so we couldn't roll out all programs that we wanted to early on. But right now, we are actively working with dialysis centers. As you note, not only is this a high-risk population, but it also is often a minority population. And so this is a key place where we could offer a vaccine. It's a trusted resource. People come 3 times a week. And in fact, we're actively working with these dialysis centers to roll out a plan for vaccination there.
Thank you. I see my time has expired, and I thank you for your presentations.